Have you ever wondered if your sexual health changes as you age? Or maybe you've felt a little unsure about exploring your sexuality later in life? If so, you're definitely not alone. Many older adults experience physical and emotional changes that impact their sexual well-being. In this video, we'll debunk common myths, share expert advice, and provide practical tips to help you navigate the complexities of sexual health in your golden years. By the end of this video, you'll feel empowered to embrace your sexuality, enhance your pleasure, and live a more fulfilling life. Masturbation is a natural and healthy part of life at any age, including your golden years. But older adults can face unique challenges and sometimes make common mistakes when it comes to this activity. In this video, we're going to talk about 8 common mistakes older adults make when masturbating and give you some tips to avoid them. Before we get started, I'd really appreciate it if you could like this video. It helps me keep spreading the wisdom of old age. If you haven't subscribed yet, make sure to hit that button and turn on the bell so you never miss a video. And hey, if you're into what we're talking about today, comment 1 below. If you think there's room for improvement, comment 0 and let me know how I can make this content better for you. Let's dive in. 1. Ignoring physical changes. As we age, our bodies naturally undergo changes that influence many aspects of our health, including sexual well-being. These changes can particularly affect sexual response, often resulting in differences in how we experience pleasure, arousal, and sensitivity. One of the primary factors contributing to these changes is hormonal fluctuation. As we grow older, levels of key hormones like estrogen and testosterone begin to shift. These hormonal adjustments can lead to a decrease in sexual desire, reduced sensitivity, and slower or more difficult arousal. For many people, this means that the body may not respond as quickly or intensely as it once did, resulting in a sense of diminished pleasure during sexual activities, including masturbation. In addition to hormonal changes, aging brings other physical shifts that can affect sexual function. For instance, the body's tissues naturally lose elasticity, and circulation may become less efficient. This can make achieving or maintaining arousal harder, as the body may take longer to respond to stimulation or feel less pronounced than it did in the past. Likewise, changes in the nervous system and muscle tone may influence how sensitive certain areas of the body are during physical touch, leading to reduced sensations of pleasure during masturbation or sexual activity. Other factors like changes in skin texture and moisture levels can also impact sexual experiences. For example, vaginal or penile sensitivity may decrease, and lubrication might not be as abundant or effective as before. These changes can make sexual activity feel less satisfying, which can cause frustration or feelings of self-consciousness. However, it's crucial to understand that these physical changes are a natural part of aging. They don't signal the end of a fulfilling sexual experience. While it might take more patience and self-compassion, these changes do not mean that sexual pleasure or self-exploration is out of reach. One of the most important things you can do to navigate these changes is to practice patience and self-awareness. It's essential to acknowledge that your body's sexual response evolves and may require more effort to achieve the same level of satisfaction as before. Instead of seeing this as a setback, think of it as an opportunity for growth and adjustment. By experimenting with different techniques and approaches to masturbation, you can discover new ways to experience pleasure. Adjusting the speed or pressure of touch, incorporating lubrication, or using a variety of stimulation methods can help enhance your experience and address changes in sensitivity or arousal. Additionally, mental stimulation, such as using fantasy, practicing relaxation techniques, or focusing on emotional connection, can contribute significantly to a more enriching experience. Exploring different strategies and remaining open to new things is key to adapting to changes that come with age. It's all about listening to your body, respecting its needs, and being open to finding new ways to enjoy your sexuality. Self-exploration doesn't stop as you age, it can evolve into something more rewarding and self-aware. Ultimately, maintaining a positive and patient attitude toward these changes will allow you to embrace your body's transformation and continue to experience a fulfilling and enjoyable sexual life, even as your physical needs shift. If you're still watching and finding this information useful, go ahead and comment one below. I'd love to hear from you. 2. Not communicating with your partner. Open and honest communication is the cornerstone of any healthy and fulfilling sexual relationship. Without it, misunderstandings, unmet needs, and frustrations can build over time. When it comes to sexual needs and desires, creating a safe, supportive, and non-judgmental space where both partners feel comfortable sharing is incredibly important. Both partners should be able to express themselves freely, without fear of criticism or rejection. If you're experiencing changes in your libido, evolving sexual preferences, or new desires, it's crucial to talk about these shifts with your partner. This is especially important if you want to incorporate masturbation into your routine or explore it as a part of your intimacy together. Masturbation is often seen as a private activity, but it can become a natural and empowering part of your sexual relationship when discussed openly. Instead of hiding it or feeling ashamed, sharing this aspect of your sexuality can lead to a greater understanding of your own body and desires while fostering deeper intimacy with your partner. It can even inspire your partner to explore solo play as a means to enhance their own pleasure. Introducing masturbation into your sexual relationship creates opportunities for experimenting with different forms of intimacy, ultimately bringing you closer. If your partner understands that you're approaching this with care and mutual respect, they may be more comfortable and open to exploring new activities. However, these conversations can be sensitive, particularly if they haven't been discussed before. To navigate this, approach the subject with empathy and understanding. Be mindful of your partner's feelings and focus on the emotional connection between you two. Emphasize how incorporating masturbation into your shared sex life can enhance your satisfaction, making it a positive addition. Unspoken desires often lead to misunderstandings, where one partner may feel neglected or left out. When desires, including those related to masturbation, aren't communicated, it's easy for feelings of frustration or emotional disconnection to arise. Regularly talking about your sexual needs ensures that both partners feel heard, supported, and understood. Many couples find that these discussions deepen their emotional bond and bring them closer together. By sharing your desires and encouraging your partner to do the same, you both develop a greater sense of trust and intimacy. The more openly you talk about your needs, the more comfortable and fulfilled you'll feel, both individually and as a couple. Ultimately, fostering open, ongoing communication helps create a more dynamic, exciting, and rewarding sexual relationship where both partners feel valued, respected, and loved. 3. Neglecting lubrication. As we get older, it's completely normal for our bodies to go through changes, including a decrease in natural lubrication. This is especially true for women, where a reduction in estrogen levels can lead to less moisture in the genital area, making activities like masturbation or sexual intimacy less comfortable. While these changes are part of the natural aging process, they can still impact the pleasure and satisfaction of these experiences. When there isn't enough lubrication, friction can cause discomfort, irritation, or even injury, particularly in sensitive areas, which makes the experience less enjoyable or downright painful. The good news? There's a simple yet effective solution to this: using a lubricant. Water-based lubricants, in particular, can provide a smooth, slippery surface that mimics the body's natural lubrication, enhancing both comfort and pleasure. These lubricants are typically gentle on the skin, easy to wash off, and safe to use with most toys or condoms, making them a versatile option. But it's important to note that not all lubricants are created equal. There are many different types available, each offering its own set of benefits and unique qualities. Some are designed for extra moisture, while others provide warming or cooling sensations or have long-lasting effects, giving you the chance to pick one that best suits your needs. Taking the time to experiment with different kinds of lubricants can be a game changer. For example, silicone-based lubricants tend to last longer than water-based ones, which can be ideal if you're looking for extended slickness. However, silicone lubricants might not be compatible with silicone-based sex toys, as they can degrade the material. On the other hand, oil-based lubricants also offer long-lasting slickness but can potentially stain fabrics and aren't suitable for use with latex condoms. Understanding how different textures, ingredients, and formulations impact your personal experience can help you find the perfect match. Whether you're seeking a silky smooth feeling, additional moisture, or a specific sensation like warmth or tingling, finding the right lubricant can significantly elevate your pleasure and make your experience more comfortable and enjoyable. It's also crucial to consider any sensitivities or allergies you might have. Some ingredients, such as glycerin or parabens, can cause irritation for certain individuals. Opting for hypoallergenic or fragrance-free options can help ensure your experience is as safe and pleasurable as possible. Using the right lubricant can make a world of difference, enhancing your overall satisfaction, reducing discomfort, and turning intimate moments into much more enjoyable and fulfilling experiences. If you're still watching and finding these lessons helpful, please comment below. It means a lot to me to know that you're along for the ride. 4. Forgetting about hygiene. Maintaining good hygiene is crucial for overall health and well-being at any stage of life. Proper hygiene not only promotes a sense of cleanliness and comfort but also reduces the risk of infections, skin irritations, and other health issues, especially when it comes to intimate areas. Neglecting personal care can lead to unwanted consequences, particularly in areas where bacteria and other pathogens can easily accumulate. Taking simple but effective steps in your hygiene routine, such as washing your hands and genital area before and after masturbation, is essential. This helps prevent the transfer of harmful bacteria or viruses, reducing the risk of conditions like urinary tract infections, UTIs, yeast infections, or skin irritations that can cause discomfort. When washing, it's important to choose a mild, fragrance-free soap that's specifically designed for sensitive skin. Soaps with added fragrances or harsh chemicals can disrupt the skin's natural balance by removing beneficial bacteria and moisture, leading to dryness, irritation, or even allergic reactions. It's best to avoid products that contain ingredients like alcohol, parabens, or sulfates, as these can strip the skin of its natural oils and make it more vulnerable to dryness and irritation. For optimal genital hygiene, always use warm water when washing, and avoid scrubbing the skin too roughly. This can irritate the sensitive tissues and cause micro tears. Instead, gently cleanse with your hands or a soft washcloth, paying particular attention to areas prone to sweat, moisture, and bacteria buildup. For women, this means wiping from front to back after using the restroom, which helps prevent bacteria from the anal region from entering the vaginal area. For men, it's important to clean under the foreskin if applicable, as neglecting this area can lead to the buildup of smegma, which can cause discomfort and even infections. In addition to regular washing, choosing breathable cotton underwear is key to maintaining good hygiene. Cotton allows for better air circulation and helps keep the genital area dry, reducing the risk of fungal infections like yeast infections. Tight-fitting clothing should be avoided, as it can trap heat and moisture, creating a warm and damp environment ideal for bacterial growth. Instead, opt for looser clothing made of natural fabrics to help keep your body cool and dry. By being mindful of these hygiene practices, you can ensure that your body remains clean, healthy, and comfortable. Regular self-care, especially in sensitive areas, supports the body's natural balance, promotes long-term health, and fosters a sense of confidence and well-being. Consistency in these habits will help you avoid unnecessary discomfort and prevent infections, ultimately contributing to better physical and mental health. 5. Rushing the process. In our fast-paced world, it's easy to get caught up in the rush, constantly pushing ourselves to meet deadlines, accomplish tasks, or reach certain milestones. But when it comes to connecting deeply with yourself or your partner, it's important to take a step back and recognize the value of slowing down, savoring each moment, and truly embracing the experience. In our desire for quick results, we often overlook how vital it is to be fully present and engaged in the journey itself. By slowing down, you allow yourself the opportunity to enjoy the experience on a deeper level. Instead of hurrying through each step, take your time to focus on every sensation, paying close attention to how your body feels in each moment. This means listening to your body, noticing the subtle shifts, and appreciating the smallest details that make each experience unique. Being present helps you remain grounded and aware, allowing you to heighten your senses and discover the full depth of pleasure and satisfaction. Instead of being frustrated by unmet expectations or the pressure to achieve something in a limited time frame, let go of that urgency. Release the need for quick results and focus on the journey, letting the sensations guide you. When we rush, we often miss the little nuances that could make the experience truly special, the way a certain touch feels, the rhythm of breath, the connection of energy. By allowing yourself the space to slow down, you create a deeper bond with your body and, if applicable, your partner. This is where true pleasure lies, not in rushing toward a finish line but in fully experiencing and appreciating each moment as it unfolds. Permit yourself to take your time, release the pressure to hurry through experiences, and savor the discoveries, sensations, and unique moments that come with taking things at your own pace. This shift in perspective not only fosters relaxation but also creates an environment where you can explore, enjoy, and connect without the burden of goals or time constraints looming over you. Taking the time to be present and engaged can lead to a far more fulfilling, rewarding, and enriching experience, one that's free from the anxiety of rushing, full of relaxation, and ripe for meaningful exploration. If you're still with me and finding these insights valuable, comment 3 below to let me know. Your feedback helps keep me going. 6. Ignoring pain or discomfort. It's important to listen to your body and recognize that pain or discomfort during masturbation is not something to ignore. Pain is not a normal part of the experience, and your body will often send signals to let you know when something isn't right. It's crucial to pay attention to these signals, as continuing despite discomfort can lead to further injury or complications. If you experience pain, irritation, or discomfort, stop immediately and assess the situation. Continuing despite discomfort may only aggravate the issue and lead to more serious consequences. There are several reasons you might feel discomfort during masturbation, such as friction, dryness, or pressure. These can often be addressed by adjusting your technique, using lubricant, or changing positions. 7. Feeling shame or guilt. Masturbation is a completely normal, natural, and healthy aspect of human sexuality. People of all ages and backgrounds engage in it, but many individuals struggle with feelings of shame or guilt when it comes to masturbation. These emotions are often deeply rooted in societal expectations, cultural norms, or personal beliefs shaped by family, religion, or media. It's not unusual for people to internalize these negative messages, making it difficult to accept this natural part of life without judgment. It's important to recognize that the shame or guilt associated with masturbation doesn't come from the act itself but rather from external pressures and harmful messages that have been ingrained over time. Society, particularly in certain cultural or religious contexts, may portray masturbation as something shameful or immoral, leading individuals to feel that their desires are somehow wrong. These messages can create a significant emotional burden, making it harder to enjoy this form of self-expression. Instead of feeling ashamed, it's vital to understand that masturbation is a personal and private matter. It's a way to connect with your body, explore your desires, and experience pleasure in a safe and consensual manner. Embracing this part of your sexuality can be incredibly liberating, helping you to better understand your needs and preferences while also relieving stress and promoting relaxation. The key to overcoming feelings of shame or guilt is to cultivate a mindset of self-compassion. Remind yourself that you deserve to have a positive relationship with your body and your sexuality. Releasing guilt and shame not only helps foster a healthier emotional state but also contributes to your overall well-being. By accepting masturbation as a normal and healthy practice, you can create a more fulfilling and authentic connection with yourself. If you find yourself struggling with negative thoughts or emotions, try to identify where these beliefs are coming from. Are they based on outdated cultural teachings, unrealistic expectations, or misinformation? By questioning these beliefs, you can begin to dismantle the negative associations and replace them with more positive, affirming thoughts. It's about embracing your right to feel good, to be comfortable with your body, and to experience joy without shame. Remember, there's nothing wrong with exploring your sexuality. It's a natural part of being human. Practice self-compassion, let go of societal judgment, and allow yourself to enjoy this part of life. If you're still watching and finding this information helpful, I'd love it if you could comment below. And don't forget to like, subscribe, and turn on notifications so you never miss our latest content. 8. Not seeking help for sexual dysfunction. Experiencing difficulties with sexual function, such as issues with arousal, orgasm, or pain, is a common concern for many individuals, and it can happen at any age. It's important to understand that these difficulties are nothing to be ashamed of, and you don't have to face them alone. If you're struggling with a lack of desire, trouble achieving arousal, difficulty reaching orgasm, or experiencing pain during sexual activity, seeking help from a healthcare professional is a crucial step toward improving your sexual health. These types of issues can arise from a variety of factors, including medical conditions, hormonal changes, emotional and psychological factors, or relationship issues. Ignoring or dismissing these concerns can lead to frustration, distress, and even a negative impact on your overall well-being. Addressing them early on is essential for maintaining a fulfilling sexual life. A healthcare provider, such as a doctor or a specialist in sexual health, can help you assess the situation in a supportive and non-judgmental manner. They may ask questions about your symptoms, lifestyle, medical history, and emotional health, and may perform tests to identify any underlying causes. These tests might include blood work to check hormone levels, screenings for chronic conditions like diabetes, or physical exams to identify any anatomical issues. Sometimes, sexual dysfunction can be a result of medications you're taking, so your doctor may also consider how your current prescriptions could be affecting your sexual health. Once the root cause is identified, a healthcare professional can recommend treatments tailored to your unique needs. This might include medication to address hormonal imbalances, counseling or therapy to explore emotional causes, or physical therapies to improve sexual function. In some cases, lifestyle changes such as improving your diet, incorporating regular exercise, or practicing stress management can also have a significant positive impact on your sexual health. For some individuals, there may be more advanced interventions, like pelvic floor exercises or even surgical procedures, depending on the nature and severity of the issue. It's also important to remember that masturbation can be a valuable tool in exploring your sexuality and overcoming sexual dysfunction. It allows you to understand your body better, discover what feels good to you, and practice different techniques that may help enhance your sexual experience. By experimenting with various types of touch, rhythm, and pressure, you can gain confidence in your sexual responses and improve your ability to experience pleasure. If you're experiencing persistent issues with sexual function, seeking professional help is the first step in regaining control and enhancing your sexual well-being. There's no need to feel discouraged or isolated in your experiences. By learning more about your body and working with a healthcare provider, you can improve your sexual health and enjoy a satisfying sex life at any age. 9. Overlooking the importance of emotional connection. Sexual health is not just about physical function, it's also deeply connected to our emotions and mental well-being. Many people overlook the importance of emotional connection when it comes to sexual intimacy, but the truth is that our emotional state can have a profound impact on how we experience pleasure and satisfaction. For older adults, changes in relationships, lifestyle, and health can all affect emotional well-being, which in turn influences sexual desire and enjoyment. Feeling disconnected from your partner, experiencing stress or anxiety, or struggling with self-esteem issues can all create barriers to intimacy. It's important to address these emotional factors and prioritize emotional connection in your relationships. Building a strong emotional bond with your partner can enhance the quality of your sexual experiences. Open and honest communication, expressing affection, and spending quality time together can help strengthen your connection and make intimacy more meaningful. When both partners feel emotionally supported and understood, they are more likely to enjoy a fulfilling sexual relationship. It's also important to address any emotional challenges you may be experiencing individually. Stress, anxiety, depression, or unresolved trauma can all impact your ability to fully enjoy sexual activities. Seeking help from a therapist or counselor can provide you with the tools to work through these challenges and improve your emotional well-being. therapy can also help couples navigate issues that may be affecting their intimacy, fostering better understanding and connection. For some individuals, focusing on emotional intimacy rather than just physical pleasure can make a significant difference in their sexual experience. This might mean spending more time on foreplay, incorporating non-sexual touch like cuddling or holding hands, or simply taking the time to talk and connect emotionally before engaging in sexual activities. By placing a greater emphasis on emotional connection, you can create a more satisfying and enriching sexual experience for both you and your partner. If you're finding these insights useful, please give this video a like, comment 5 below, and remember to subscribe to our channel for more content that empowers and informs. Your support means the world to me, and I'm grateful to have you here. 10. Not exploring new ways to experience pleasure. As we age, our bodies change, and what once worked for us in terms of sexual pleasure may no longer be as effective or satisfying. It's common for older adults to stick to familiar routines and avoid trying new things, but this can limit the potential for a fulfilling and exciting sexual life. Not exploring new ways to experience pleasure can lead to stagnation and reduced satisfaction. It's important to recognize that sexual pleasure is a lifelong journey, and there's always room for growth and exploration. Being open to trying new things, whether it's experimenting with different techniques, using toys, or exploring fantasies, can bring a sense of excitement and novelty to your sexual experiences. This can be particularly helpful if you're experiencing changes in sensitivity or arousal, as it allows you to discover new ways to feel pleasure. Sex toys can be a great way to add variety to your sexual activities. There are many different types of toys available, designed to provide different sensations and enhance pleasure. Whether you're looking for something to use alone or with a partner, incorporating toys can help you explore new sensations and find what works best for you. Another way to explore new experiences is by incorporating different types of touch, pressure, or speed during masturbation or partnered activities. Paying attention to what feels good and experimenting with different techniques can help you discover new erogenous zones and increase your overall satisfaction. For some individuals, exploring fantasies can also be an exciting way to enhance pleasure. Fantasizing allows you to tap into your imagination and create scenarios that excite you. Sharing these fantasies with a partner, if you're comfortable, can add an extra layer of intimacy and connection to your relationship. The key is to remain open-minded and willing to step outside of your comfort zone. By trying new things and embracing the changes that come with age, you can continue to experience a vibrant and satisfying sexual life. If you're still watching, please comment 6 below. I appreciate your support and hope you're finding this journey as enlightening as I do. 11. Not prioritizing self-care and relaxation. One of the most common mistakes older adults make when it comes to sexual well-being is neglecting the importance of self-care and relaxation. Stress and anxiety are significant barriers to sexual satisfaction and can negatively affect your libido, arousal, and overall experience. Taking time to focus on your own well-being and relaxation is essential to maintaining a healthy and enjoyable sexual life. Self-care looks different for everyone, but it generally includes activities that help you relax, recharge, and take care of your mental and physical health. Practicing relaxation techniques such as deep breathing, meditation, or yoga can help reduce stress and improve your overall well-being, which in turn positively impacts your sexual health. When you feel more relaxed and in tune with your body, you are more likely to enjoy intimate moments without the pressure or distractions that stress can cause. Prioritizing self-care can also mean giving yourself permission to rest when needed, maintaining a balanced diet, staying physically active, and seeking out activities that bring you joy. Regular exercise, in particular, can have a huge impact on your sexual health. It helps improve blood flow, boosts your mood, and increases energy levels, which all contribute to better sexual experiences. Taking care of your mental health is just as important as taking care of your physical health. If you find yourself struggling with negative thoughts, anxiety, or depression, consider seeking help from a therapist or counselor. Talking to a mental health professional can provide you with the tools you need to cope with stress, boost your self-esteem, and feel more confident in your sexual relationships. If you're finding these lessons helpful, be sure to like this video, subscribe to the channel, and click the notification bell so you're always up to date with our latest content. Your support helps us continue to share valuable insights and empower others to live their best lives. 12. Ignoring the role of foreplay. Another common mistake older adults make is overlooking the importance of foreplay. Foreplay is a crucial part of sexual intimacy, especially as we age. It helps increase arousal, enhances pleasure, and creates a stronger emotional connection with your partner. Ignoring foreplay can lead to less satisfying sexual experiences and may even result in discomfort or pain, particularly if the body hasn't had enough time to become fully aroused. As we age, our bodies often require more time to reach the same level of arousal that might have come more easily in our younger years. Foreplay is the perfect way to bridge that gap, allowing both partners to gradually build excitement and ensure that their bodies are ready for more intimate activities. Engaging in foreplay helps increase blood flow, enhances lubrication, and heightens sensitivity, making the overall experience more enjoyable and comfortable. Foreplay doesn't have to be complicated, it's all about focusing on touch, connection, and intimacy. This can include activities like kissing, caressing, massaging, or even just taking the time to talk and connect with your partner on an emotional level. The goal is to create an atmosphere of trust, comfort, and anticipation, allowing both partners to fully relax and enjoy the experience. For many couples, foreplay can be just as pleasurable, if not more so, than intercourse itself. It's a chance to explore each other's bodies, discover what feels good, and build a sense of intimacy and closeness. Taking your time with foreplay can help both partners feel more connected, supported, and in tune with each other's needs, ultimately leading to a more satisfying sexual experience. If you're not sure where to start, try experimenting with different types of touch, incorporating sensual massages, or using tools like scented oils or feather ticklers to add variety. The key is to communicate with your partner, explore together, and be open to trying new things. Foreplay is an essential part of a healthy sexual relationship, and giving it the time and attention it deserves can make all the difference. 13. Not being open to changes in sexual preferences. As we age, our sexual preferences and desires can change. What once worked for you or brought you pleasure may no longer have the same effect, and that's completely normal. Unfortunately, many older adults fall into the trap of sticking to the same sexual routines out of habit or fear of trying something new. Not being open to these changes can lead to decreased satisfaction and a sense of stagnation in your sexual life. Being open to change means embracing the idea that your sexuality is a lifelong journey that evolves over time. It's important to stay curious and willing to explore new activities, techniques, or fantasies that may bring you pleasure. This might mean trying new positions, incorporating sex toys, experimenting with role play, or even exploring different settings for intimacy, whatever feels right for you and your partner. Communication is key when it comes to exploring changes in your sexual preferences. Talk openly with your partner about what you're interested in trying, and encourage them to share their own desires as well. This kind of open dialogue can help both partners feel more comfortable and excited about exploring new aspects of their sexuality together. It's also important to remember that it's okay if your preferences change over time. What brought you pleasure in the past may no longer be as enjoyable, and that's perfectly natural. The key is to be adaptable and willing to explore new things that bring you joy and satisfaction. By remaining open to change, you can continue to experience a vibrant and fulfilling sexual life, no matter your age. 14. Overlooking the impact of medications. As we age, it's common for many of us to take medications for various health conditions. However, what's often overlooked is the impact these medications can have on our sexual health. Many medications, including those for high blood pressure, depression, and chronic pain, can have side effects that affect libido, arousal, and overall sexual function. If you've noticed changes in your sexual health that coincide with starting a new medication, it's important to talk to your healthcare provider. They may be able to adjust your dosage, switch you to a different medication, or recommend strategies to help mitigate these side effects. It's important not to stop taking your medication without consulting your doctor, as this could have serious health consequences. Being proactive about your sexual health means understanding how your medications might be affecting you and seeking solutions that allow you to maintain a fulfilling sex life. Your healthcare provider is there to help, and they can work with you to find a treatment plan that supports both your overall health and your sexual well-being. 15. Not valuing emotional intimacy. For many older adults, the focus on physical aspects of sexual health can sometimes lead to overlooking the importance of emotional intimacy. Emotional intimacy is a critical component of a fulfilling sexual relationship, and it becomes even more important as we age. Feeling emotionally connected to your partner can enhance your overall experience, increase satisfaction, and create a deeper bond. Emotional intimacy involves being vulnerable, open, and honest with your partner. It's about sharing your thoughts, fears, desires, and feelings in a way that fosters trust and connection. When both partners feel emotionally connected, they are more likely to feel comfortable expressing their needs, experimenting with new things, and enjoying a fulfilling sexual relationship. There are many ways to build emotional intimacy, such as spending quality time together, engaging in meaningful conversations, expressing appreciation for one another, and being physically affectionate outside of sexual activities. Small gestures, like holding hands, cuddling, or simply listening attentively, can go a long way in strengthening your emotional connection. For those who are experiencing challenges in building emotional intimacy, seeking the guidance of a couples therapist or counselor can be incredibly beneficial. Therapy can provide a safe space to explore any underlying issues, improve communication, and learn tools to strengthen your bond. Emotional intimacy is the foundation upon which a healthy sexual relationship is built, and nurturing it can lead to a more satisfying and rewarding experience for both partners. 16. Not taking care of physical health. Your physical health plays a significant role in your sexual well-being. Neglecting your physical health can lead to decreased energy, reduced stamina, and a decline in sexual desire and performance. Taking care of your body through regular exercise, a balanced diet, and proper medical care is essential for maintaining a healthy sex life as you age. Exercise, in particular, has numerous benefits for sexual health. It helps improve circulation, boost energy levels, and enhance mood, all of which contribute to better sexual function. Activities like walking, swimming, yoga, or strength training can help keep your body in good shape and support a healthy libido. A balanced diet is equally important. Eating a diet rich in fruits, vegetables, lean proteins, and healthy fats can help support overall health and improve sexual function. Certain foods, like those rich in antioxidants and omega-3 fatty acids, can help improve blood flow and boost libido. Staying hydrated is also important, as dehydration can lead to fatigue and reduced energy levels. Lastly, regular medical checkups are crucial. Many health conditions, such as diabetes, cardiovascular disease, and hormonal imbalances, can impact sexual health. By staying on top of your health and managing any chronic conditions, you can help maintain a fulfilling and enjoyable sex life well into your golden years. If you found this part helpful, make sure to give this video a thumbs up and share it with others who might benefit. Don't forget to subscribe and hit the notification bell so you're always in the loop with our latest content. We're here to help you live your best, most fulfilling life. 17. Overlooking the benefits of sexual health products. As we age, our bodies change, and so do our needs when it comes to sexual pleasure. One mistake that older adults often make is overlooking the benefits of using sexual health products. There are numerous products available that can enhance pleasure, increase comfort, and make sexual activities more enjoyable. Being open to incorporating these products into your sexual routine can help you maintain a satisfying sex life. Sexual health products like vibrators, dildos, lubricants, and arousal creams can add variety and excitement to your experiences. Vibrators, for example, can be especially helpful for those who may have difficulty achieving or maintaining arousal due to decreased sensitivity. These devices can provide additional stimulation that makes it easier to reach orgasm and enjoy the experience more fully. For couples, using sexual health products together can also bring a new level of intimacy and connection. Incorporating toys or trying out different types of lubricants can create a sense of playfulness and curiosity, encouraging you and your partner to explore new ways to pleasure each other. It's all about being open-minded and willing to experiment to see what works best for both of you. If you've never used sexual health products before, it's natural to feel a bit unsure or hesitant. Start small, maybe try a simple lubricant or a small vibrator, and see how it feels. Remember that there's no right or wrong way to use these products. The key is to find what enhances your pleasure and comfort. Don't be afraid to communicate with your partner about what you're interested in trying, and encourage them to share their own thoughts as well. Ultimately, sexual health products are tools that can help you adapt to the changes that come with aging. They can make sex more comfortable, reduce discomfort, and help you maintain a satisfying level of intimacy. If you're still with me and finding this content helpful, I'd love it if you could comment 7 below and let me know how you're enjoying the video. 18. Neglecting the importance of communication during sex. Effective communication is essential in any relationship, and this holds especially true for sexual relationships. Unfortunately, many older adults make the mistake of not communicating effectively during sex. This can lead to misunderstandings, unmet needs, and frustration for both partners. Open and honest communication is key to ensuring that both you and your partner are satisfied and comfortable during sexual activities. When it comes to communicating during sex, it's important to be both receptive and expressive. This means not only being willing to share your own needs and desires, but also being open to listening to your partner's. Communication doesn't have to be complicated or awkward. Sometimes it's as simple as letting your partner know what feels good, what doesn't, or suggesting a change in position. It can be helpful to have a conversation about your sexual preferences and boundaries outside of the bedroom as well. Talking about these things in a relaxed setting can make it easier to express your desires without the pressure of the moment. It can also help you better understand each other's needs, leading to a more fulfilling sexual relationship. Nonverbal communication is also an important aspect of intimacy. Paying attention to your partner's body language, breathing, and facial expressions can provide valuable insight into what they are feeling. Likewise, using your own body language to signal what feels good or to guide your partner can be an effective way to communicate without words. If you're unsure of how to start these conversations, try approaching them from a place of curiosity and care. Ask your partner what they enjoy, what they'd like to try, and share your own thoughts as well. The more open and honest you are with each other, the more comfortable you'll both feel, leading to more satisfying and intimate experiences. 19. Underestimating the impact of mental health on sexual well-being. Mental health plays a crucial role in our sexual well-being, yet it's often overlooked. Stress, anxiety, depression, and other mental health issues can significantly impact sexual desire, arousal, and overall satisfaction. For many older adults, the changes that come with aging, such as retirement, health issues, or the loss of loved ones, can take a toll on mental health, which in turn affects sexual health. If you're experiencing mental health challenges that are impacting your sexual well-being, it's important to seek support. Talking to a therapist or counselor can help you work through these challenges and develop coping strategies that improve both your mental health and your sexual health. Mental health professionals can also provide valuable tools for managing stress, improving self-esteem, and fostering a more positive outlook on life, all of which can enhance your sexual experience. Mindfulness practices, such as meditation or deep breathing exercises, can also be beneficial. These techniques can help reduce anxiety, increase relaxation, and improve your connection with your body. By practicing mindfulness, you can learn to be more present during intimate moments, which can lead to greater satisfaction and pleasure. It's also important to communicate with your partner about how you're feeling. If you're struggling with anxiety or stress, let them know so they can support you. Being open about your mental health can help reduce any feelings of pressure or expectation, allowing both of you to approach intimacy with greater understanding and compassion. 20. Not taking time for aftercare. Aftercare is an important part of any intimate experience, yet it's often overlooked. Taking the time to care for each other after sexual activity can help strengthen the emotional bond between partners, promote relaxation, and ensure that both partners feel valued and cared for. Aftercare can be as simple as cuddling, talking, or sharing a comforting touch. For many people, the moments following intimacy are a time when they feel vulnerable and open. Taking time for aftercare can help both partners feel more connected and appreciated. It's a chance to check in with each other, share how you're feeling, and express any thoughts or emotions that may have come up during the experience. Aftercare doesn't have to be complicated, it's all about being present with each other and providing comfort. This might mean holding each other, talking about what you enjoyed, or simply lying together in a relaxed and comfortable position. The key is to make sure that both partners feel seen, heard, and valued. If you're finding these tips helpful, don't forget to give this video a thumbs up and subscribe to our channel for more content on maintaining a healthy and fulfilling sex life. Your support helps us continue to share valuable insights and empower others to live their best lives. 21. Not exploring sensuality outside of sexual activities. Sexual intimacy is only one aspect of a fulfilling relationship. Sensuality and physical affection play a major role in maintaining connection and intimacy as well. Many older adults make the mistake of not exploring sensuality outside of sexual activities, which can lead to a sense of disconnection and decreased desire over time. Sensuality is all about experiencing pleasure through the senses: touch, sight, sound, taste, and smell. Incorporating sensual activities into your daily routine can help keep the spark alive and maintain a strong emotional and physical connection with your partner. This might include giving each other massages, taking a warm bath together, cooking a special meal, or simply holding hands and enjoying each other's presence. Physical affection, such as cuddling, kissing, or even just sitting close to each other, can also help maintain intimacy and connection. These small acts of affection can help keep the bond between you and your partner strong, even during times when sexual activity may not be possible or desired. By making an effort to be physically affectionate and sensual with each other, you can help maintain a sense of closeness and desire that enhances your overall relationship. 22. Forgetting to laugh and have fun. Sex and intimacy should be enjoyable, yet many people become so focused on performance or expectations that they forget to have fun. Laughter and playfulness are important components of a healthy sexual relationship, especially as we age. Being able to laugh with your partner, make light of awkward moments, and approach intimacy with a sense of humor can help reduce anxiety, build trust, and create a more relaxed and enjoyable experience. It's normal for things not to go perfectly every time. Maybe there's an awkward noise, or one of you gets a cramp. Instead of letting these moments create tension or embarrassment, try to embrace them with laughter and playfulness. Being able to laugh together during intimate moments can help foster a sense of connection and make the experience more enjoyable for both partners. Remember, intimacy is about connection, not perfection. By letting go of expectations and focusing on having fun, you can create a more relaxed and fulfilling sexual experience. Don't be afraid to be playful, try new things, and enjoy the journey together. 23. Not seeking education on sexual health. Sexual health is a lifelong journey, and there is always more to learn. Unfortunately, many older adults make the mistake of not seeking out education or information on sexual health as they age. Understanding how your body changes, what to expect, and how to adapt to those changes is key to maintaining a fulfilling sex life. There are many resources available, from books and online articles to workshops and classes, that can provide valuable information on sexual health and well-being. Don't be afraid to seek out information, ask questions, and educate yourself on how to maintain a healthy and enjoyable sex life as you age. If you found this content helpful, please give this video a like, comment below, and subscribe to our channel for more insights. We're here to support you in living your best, most fulfilling life, at any age. 24. Overlooking the importance of adaptability. One of the key aspects of maintaining a satisfying sex life as we age is adaptability. Our bodies change, our desires shift, and what worked for us in the past may not be as effective anymore. A common mistake that older adults make is failing to adapt to these changes and instead sticking rigidly to old habits. However, the willingness to be flexible and open to new approaches can make a significant difference in your sexual well-being. Adaptability can mean many things, from trying new techniques to changing your routine or exploring new ways of connecting with your partner. For example, if you find that a particular position is no longer comfortable, consider experimenting with different positions that accommodate your body's needs. If you find that your desire for sex fluctuates, focus on nurturing other forms of intimacy that keep you and your partner connected. It's also important to adapt to the idea that intimacy doesn't always have to lead to intercourse. Sometimes, just being physically close, sharing touch, or cuddling can be enough to foster a sense of intimacy and connection. By embracing these changes and being willing to adapt, you can continue to experience a rich and fulfilling sex life, even if it looks different from what it did in your younger years. Adaptability is not only about physical adjustments, it's also about mental and emotional flexibility. Be open to new ideas, and don't shy away from having honest conversations with your partner about what feels good, what doesn't, and what you'd like to try. Maintaining an open and adaptable mindset is crucial for continuing to enjoy a satisfying and pleasurable sexual life. 25. Ignoring the role of physical comfort. As we age, comfort becomes increasingly important during sexual activity. Ignoring physical comfort is a mistake that can lead to discomfort, frustration, or even a complete avoidance of intimacy. It's essential to take the time to create a comfortable environment that supports both partners' needs. Physical comfort can be influenced by many factors, such as the setting, the time of day, and even the temperature of the room. Make sure you're in a space that feels safe and relaxing. Consider using extra pillows for support, setting the room temperature to a comfortable level, and ensuring that your bed or other surfaces are suitable for your comfort needs. Sometimes, a simple adjustment like using a pillow to support your back or hips can make a significant difference in your comfort level. Additionally, consider the timing of your intimate moments. If you find that you're more tired or less energetic at certain times of the day, try scheduling intimacy during times when you both feel more awake and relaxed. Comfort also extends to the use of lubricants and other products that can make sexual activities more pleasurable and less stressful. As we've discussed, natural lubrication can decrease with age, and using a high-quality lubricant can make all the difference in ensuring comfort and pleasure. The key is to listen to your body, be attentive to your needs, and make the necessary adjustments to create a comfortable and enjoyable experience. 26. Neglecting to celebrate small moments of intimacy. Sexual intimacy is often thought of in grand terms, but the truth is that some of the most meaningful moments come from the small, everyday acts of closeness that build connection over time. A common mistake is to overlook these small moments, instead placing all the focus on the big moments like intercourse. Celebrating these small gestures of intimacy can help strengthen your bond and maintain a sense of closeness and love. Holding hands while walking, giving your partner a gentle back rub, sharing a long hug, or even just making eye contact and smiling can all be powerful acts of intimacy. These small moments help create a sense of warmth and affection that supports a healthy sexual relationship. They remind you both that intimacy isn't just about physical pleasure, it's about being present, connected, and caring for one another. Celebrating these small moments also means being mindful and intentional about how you express love and affection. A gentle touch, a kind word, or a shared laugh can be incredibly powerful in maintaining emotional closeness. By acknowledging and valuing these moments, you can foster a deeper sense of intimacy that enriches your overall relationship. If you're finding this content helpful, please give this video a thumbs up and don't forget to subscribe to our channel. We're here to help you maintain a fulfilling, healthy, and happy life at any age. 27. Not being patient with yourself or your partner. Patience is key when it comes to maintaining a satisfying sex life as we age. Our bodies change, our needs shift, and our responses may be different than they used to be. Not being patient with yourself or your partner can lead to frustration, disappointment, and a sense of inadequacy. It's important to recognize that these changes are natural and that it's okay for things to take more time. Being patient means allowing yourself the space to explore without pressure or expectation. It means giving your body the time it needs to respond, and being understanding if things don't go as planned. It also means extending that same patience to your partner, recognizing that they may also be experiencing changes that affect their sexual response. Instead of focusing on achieving a specific outcome, focus on enjoying the journey. Take your time to explore each other's bodies, savor the sensations, and be fully present in the moment. By letting go of expectations and practicing patience, you can create a more relaxed and enjoyable experience for both you and your partner. Remember, intimacy is not about achieving perfection, it's about connection, exploration, and pleasure. By being patient and compassionate with yourself and your partner, you can create a more fulfilling and rewarding sexual relationship. 28. Fearing vulnerability. Vulnerability is an essential part of intimacy, yet it's something that many people fear, especially as they age. The changes that come with aging, such as physical differences or health issues, can make individuals feel self-conscious or insecure. Fearing vulnerability can create barriers to intimacy and prevent you from fully enjoying your sexual experiences. It's important to recognize that vulnerability is what allows for true connection. When you allow yourself to be vulnerable with your partner, you open the door to deeper intimacy, trust, and understanding. This means being willing to share your fears, your insecurities, and your desires openly and honestly. If you're feeling insecure about changes in your body or your abilities, talk to your partner about it. Chances are, they have their own insecurities too. By sharing these feelings and supporting each other, you can create a safe space where both partners feel accepted and loved. Vulnerability is not a weakness, it's a strength that allows you to connect on a deeper level and experience greater intimacy. 29. Not seeking support when needed. There is no shame in seeking support for sexual health concerns. Whether it's talking to a doctor, seeking therapy, or joining a support group, getting help when needed is crucial for maintaining a fulfilling sex life. Many older adults hesitate to seek support due to embarrassment or the belief that sexual health isn't a priority at their age. However, sexual well-being is an important aspect of overall health, and addressing concerns can significantly improve quality of life. If you're experiencing difficulties with arousal, pain during sex, or other sexual health concerns, talk to your healthcare provider. They can help identify the underlying causes and recommend treatments or strategies to address the issues. For emotional or psychological concerns, consider speaking with a therapist who specializes in sexual health. Therapy can be a helpful tool for addressing anxiety, building self-esteem, and improving communication with your partner. Seeking support is a proactive step towards maintaining a healthy and enjoyable sex life. It shows that you value your well-being and are committed to making the necessary changes to improve your quality of life. 30. Forgetting to have fun and be playful. Sexual intimacy should be a source of joy and connection, but sometimes, we become so focused on the mechanics or the expectations that we forget to have fun. Playfulness is an important part of maintaining a satisfying sexual relationship, especially as we age. It's about letting go of the need to be perfect and instead embracing the opportunity to connect, laugh, and enjoy each other's company. Being playful can mean trying new things, being open to spontaneity, and not taking yourself too seriously. Whether it's sharing a laugh over an awkward moment, trying out a new position that ends up in a fit of giggles, or simply enjoying the moment without any pressure, playfulness helps to reduce anxiety and build a stronger connection with your partner. Approaching intimacy with a sense of fun can also make the experience more enjoyable and relaxed. It's okay if things don't go perfectly, what matters most is the connection and the joy you share with your partner. By being playful and open, you can create a more positive and fulfilling sexual experience for both of you. Conclusion. Thank you so much for joining me on this journey through understanding sexual health and intimacy in the golden years. We've covered a lot of ground, from addressing physical changes and embracing new techniques to prioritizing emotional connection and having fun. Remember, intimacy is about connection, pleasure, and embracing the changes that come with age. It's a lifelong journey that can be fulfilling, joyful, and deeply rewarding. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe to our channel. Hit that notification bell so you never miss out on our latest content. I'd love to hear your thoughts, comment below with something new you learned or a tip you're excited to try. Your support means the world to me, and I look forward to continuing this journey with you. Remember, a fulfilling sex life is possible at any age. Embrace it, enjoy it, and let your sexuality shine.